Hi everybody, it's Maeve. Today I'm going to do my treatment demonstration with my patient, Marianne, also known as my mom. I'm going to be demonstrating the Masako Maneuver, and so I'm going to pretend like I'm actually in a treatment session with her. So I have gloves and a mask, and that's all you need as far as materials. Everything else you need is just the patient and their tongue. Okay? All right. Hi Marianne, how are you today?
Good, how are you?
Good. So what we're going to do today is try a treatment approach called the Masako Maneuver. It's also called the tongue hold maneuver. This treatment targets the swallowing problem that you have. And when we did your swallow study, we found that the walls of your throat, which is called the posterior pharyngeal wall, is not able to move forward and touch the base of your tongue. And this affects how your food is able to move down your throat into your esophagus. So this technique is going to aim to strengthen those pharyngeal muscles as well as the base of your tongue. And it's going to help to make sure that you can safely push food down into your esophagus. So the only materials we need for this exercise are you and your tongue. I'm going to wear gloves and a face mask to protect myself and you. Okay?
Okay.
Let's get started.
Okay.
So before you start using this technique, I'm going to show you how to do it and what is important to focus on. So first, I'm going to stick out my tongue as far as I can, and then I'll gently bite down on it. After I do that, I'm going to swallow some saliva while keeping my tongue extended and between my teeth. So just like this. Okay?
Mm-hmm.
Now, one thing I really want you to focus on when we do this is that if you feel this part of your throat, it's called your thyroid prominence. One of our goals when we're doing this exercise is you need to elevate that part of your throat and keep it elevated for about 2 seconds. That's really going to help to strengthen those posterior walls to come forward. Okay? So as I swallow, watch this time as I swallow, I'm going to feel for my thyroid prominence to elevate. And once I've held it for at least 2 seconds, I'm going to finish the swallow. Okay?
Yeah.
Okay?
Got it.
All right. Do you have any questions before you give it a try?
I don't.
Okay, great. So now I want you to try, and I'm going to help you as you practice. I want you to first find your thyroid prominence. So feel around on your throat. Move your hand a little bit up. Good. Now just do a regular swallow and see if you can feel it elevate.
Mm-hmm.
So you felt it move up?
Mm-hmm.
Good. Okay? Now I want you to practice the exercise without focusing on your thyroid prominence. So stick out your tongue, gently bite down, and swallow. Good. You can do that a couple times, and then once you feel comfortable, I want you to practice while feeling your thyroid prominence.
Okay. I can't swallow.
Okay. Why don't you take a sip of water for me? Okay. So it's important that you don't use this exercise with any kind of food or drink, because when you bite down on your tongue, it's pulling the base of your tongue forward, and that's leaving your airway partially unprotected. So if you have food or water in your mouth, then it could possibly go into your airway and you could choke.
Right.
So that's why we're doing it with saliva only.
Okay.
I do want you to take sips of water every now and then when we do your trials, you'll take a sip of water in between every trial.
Okay.
That way you can stay hydrated and help produce some more saliva.
So try again?
Yeah. One more thing I want to talk about is if in the future, because you're in the hospital right now for, let's say you had a stroke, if you have a surgery that you don't know of right now, but maybe in the future you have to have surgery, or you feel swelling in your throat, do not use this exercise. It's not going to help, okay? So we're going to use it for now, but if things change in the future, then we may not use it anymore. Okay, so why don't you go ahead and try again. Good. So did you feel it elevate and then you counted to 2?
I don't think I counted to 2.
Okay, that's fine.
Should I do it again?
Let's try that again and this time count to 2.
Should I do this?
If it helps you to feel it elevate, then you're more than welcome to do so.
Now, did I count to 2 at the beginning or after I
Once
swallowed?
you feel it elevate, as
Oh.
soon as it elevates, start counting and then
Try that.
release.
Oh, okay, I don't think I did that.
Okay, you can try again.
Okay.
Good. That was good. I could see it elevate.
Elevate it, and then 1,000, 2, 1,000.
Right.
Okay.
What also might help is if you stick your tongue out a little bit further, because if that's as far as it can go, that's fine.
Oh.
But you might want to try and get it out as far as you can.
Should I do it again?
Yeah, let's try it one more time.
I'm having a hard time swallowing.
Okay, go ahead and take a sip of water.
Is it me just trying too hard?
It could be. It's something. It's not necessarily an easy task. It sounds like it would be an easy task,
Right.
but you're feeling for anatomy that you're not very familiar with, and you're not used to being aware of your swallow.
Yeah.
You're used to doing it reflexively.
Right.
But this is going to help bring you back to where you were before you had your stroke. Okay.
Try again.
So what we'll do now is I'm going to take some data. We're going to do 10 trials, and I'm going to flip the camera around so that it's facing you directly and we can see your swallow. But I want you to go through it 10 times, and I'll offer you some cueing every now and then, but I want you to do your best to feel the thyroid prominence elevate, count to 2 seconds, and release.
Okay.
Okay? Okay, Marianne, I've turned the camera around so we can take some data with this treatment. What I want you to do is I want you to do it 10 times, and I'll count for you how many trials we move through, okay? So remember, you're sticking your tongue out, gently biting down, swallowing to feel that your thyroid prominence elevated, and then hoping to get it there for 2 seconds, and then swallow. After each swallow, please take a sip of water. Are you ready?
I'm ready.
Okay, go ahead. Good job.
Okay. I couldn't swallow that time.
Okay. Take a sip of water for me. Well done. I could see you counting in your head for 2 seconds. That was your 3rd trial? Or was that your 4th? That was your 4th. Ha! Thank you. Now we're on your 5th.
I can't swallow.
Okay. Take a sip of water for me. All right, trial number 6.
Okay.
Did you feel it?
Yes.
Okay, good. All right, trial number 7.
Okay.
Trial number 8. Well done. Trial number 9.
I couldn't swallow that one.
Okay. Take a sip for me. All right, and last trial.
I couldn't swallow.
All right. Okay, and we're all done with that. Marianne, you did really well today. I really appreciate you working with me. So what I want you to do with this exercise is I want you to continue to do it throughout the day. Even on the days that I don't see you, I want you to do it 3 times a day for 5 days a week for the rest of your time in the hospital.
3 times 10 times each?
Yes. So 3
30.
sets of 10.
3 sets of 10.
Throughout the day. Try not to do them back to back to back. So maybe do a set in the morning, a set after or before lunch, and then a set after before dinner. Okay?
Okay.
All right. So I will continue to work on this with you in our sessions, and hopefully we can see some improvement. Okay?
Yes, thank you.
All right.